So what are some drugs or medications that should not be taken with psychotropics?
As a general rule, any drug that can cause a cognitive impairment shouldn't be used with psychotropics. And we're talking the most common is alcohol. And the other second most common, everybody considers innocuous, are the cough and cold preps, either prescription or over-the-counter. The over-the-counter have antihistamines that can cause significant drowsiness and be additive with the psychotropic meds. And I have a list here of adverse reactions and contraindications and cautions on a very common psychotropic medication, Zyprexa. This is the adverse reactions that they have reported. Only 2 pages long.
Oh my gosh.
So but weight gain, they extrapyramidal symptoms, as we talked about before, and the whole GI thing, the constipation or laxative effect on some drugs, and then contraindications and cautions if the patient has any of these medical conditions, whether it's diabetes or they're elderly or they are on certain medications that can slow down the GI tract. These things can all have additive effects to a patient. So, and every one of the drugs that we would be talking about would have lists like this that go on and on and on.
Yeah, just huge lists.
So, but the most common, the rule is do not share medications with relatives or friends because you really don't know what that medication is for. I'll be talking to people and they're taking it. I need my heart pill. Okay. Well, actually, it's a blood pressure pill. So the layperson doesn't know what it's for, or they'll come in and ask for a specific drug by class, and we're looking, it's not on their profile.
Yeah.
And they think they're taking it for one thing, but not for the other, and they don't have a clue as the side effects. So when you offer a medication to somebody, it's really putting them at risk.
So we need to really make sure that we don't have families bringing in drugs for their family members that are in our facilities.
Even I didn't mention that, but it's very common. Oh, try this natural thing. It's natural, so it's going to be good, right? Yeah. Okay. Well, there's a whole list of natural products that can cause significant side effects with drugs and should not be taken with psychotropic drugs, whether it's valerian or any of the various common herbal type things. The herbs, before the medicine we've developed, herbs were the only thing around.
Yeah.
And they, in many cases, are very potent. And so they shouldn't be brought in to the patients in a long-term care setting.
Yeah, because there is sort of that attitude that it's like, I didn't need a prescription for this, so it should be totally safe to take, but that's just wrong.
Definitely. Even a simple thing like, they're a little bit dizzy, so let's bring them in a motion sickness pill for travel. Well, that has significant anticholinergic problems associated with it, and in many cases shouldn't be given to a patient.
So it's something that you always want to check with a pharmacist first.
Pharmacist or the doctor.
Or their doctor.
I wouldn't take the responsibility of somebody saying, go ahead, give it to Uncle Harry.
Yeah.
No, that's the doctor's call.
That's the doctor's call, okay.
And medication and medical care is so fragmented. Even the doctor who is treating maybe one part of the urologist, he doesn't have a clue as to what the GP is giving the patient. So whoever is in charge of the whole patient, the internist or the family practice doc, should be the one who decides what to give to the
Making
patient.
all of those all those decisions. Yeah, that makes sense.